Hello, my name is Rosemary Huff-Pio, and this is my presentation and case study on fibromyalgia. So let's look at what is fibromyalgia. Fibromyalgia is a disorder characterized by widespread musculoskeletal pain, accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia causes painful sensations by affecting the way your brain processes pain signals. Researchers also believe that symptoms begin after physical trauma, surgery, infection, or significant psychological stress. In other cases, symptoms gradually accumulate over time with no single triggering event. Researchers believe repeated nerve stimulation causes the brains of people with fibromyalgia to change. This change involves an abnormal increase in levels of certain chemicals in the brain that signal pain, such as neurotransmitters. In addition, the brain's pain receptors seem to develop a sort of memory of the pain and become more sensitive, meaning they overreact to pain signals. Women are more likely to develop fibromyalgia than men. Other common factors of fibromyalgia are tension headaches, temporomandibular joint disorders, irritable bowel syndrome, and anxiety and depression. Signs and symptoms. Widespread pain. The pain associated with fibromyalgia often is described as constant dull ache that has lasted for at least 3 months. To be considered widespread, pain must occur on both sides of your body and above and below your waist. Fatigue. People with fibromyalgia often wake up tired even if they had a full night's sleep. Sleep is often disrupted by pain, and many patients with fibromyalgia have other sleep disorders such as restless leg syndrome and sleep apnea. Cognitive difficulties. Fibromyalgia often impairs the ability to focus, pay attention, and concentrate on mental tasks. Some other symptoms of fibromyalgia include chronic headaches, sleep disorders, dizziness, cognitive impairment, memory impairment, anxiety and depression, muscle pain, fatigue, and twitches. You can have joint morning stiffness, urinary problems, reproductive system. A lot of women have problems with their menstrual cycle. You can have nausea, chest pain, problems with your skin, your vision. It can cause weight gain, cold symptoms. Causes. Doctors aren't exactly sure what causes fibromyalgia, but it most likely involves a variety of factors working together. It's not usually one thing. Genetics. Because fibromyalgia tends to run in families, there may be certain genetic mutations that make you more susceptible to developing the disorder. Infections. Some illnesses appear to trigger or aggravate fibromyalgia. Physical or emotional trauma. Fibromyalgia can sometimes be triggered by physical trauma, such as a car accident. Psychological stress may also trigger the condition. Risk factors. Some of the risk factors include gender. Fibromyalgia is diagnosed more often in women than men. It can affect men and it also can affect children, but it happens more so in women. Family history. You may be more likely to develop fibromyalgia if a relative has had the condition. Other disorders. If you have osteoarthritis, rheumatoid arthritis, or lupus, you may be more likely to develop fibromyalgia. Diagnosis. In the past, doctors would check 18 specific points on a person's body to see how many of them were painful when pressed firmly. Newer guidelines don't require a tender point exam. Instead, fibromyalgia diagnosis can be made if a person has had a widespread pain for more than 3 months with no underlying medical condition that can cause the pain. And doctors will often conduct blood tests to rule out other diseases and disorders. So a doctor won't diagnose you of having fibromyalgia until they've ruled out any other disease or disorder. And you can see right here with all the points that they would check. Epidemiology. More than 5 million Americans are affected by fibromyalgia, and 80 to 90% of people diagnosed are women. But again, men and children can be diagnosed, just 80-90% are women. First signs usually occur between the ages of 35 to 60 years of age. This doesn't mean that it can't affect people that are younger or older. That's just the most common age. And again, here are some of the things that, although there's no definite cause, these are factors in like what can cause fibromyalgia. So like infections and trauma. Treatment. Since there is not one medication that doctors suggest multiple medications to help cope with fibromyalgia. Some of them, you can use pain relievers, over-the-counter pain relievers such as Tylenol and ibuprofen, Motrin, can help relieve pain. And antidepressants will help. They'll help you get sleep at night. Anesthesia drugs such as Lyrica. Lyrica was actually the first drug approved by the Food and Drug Administration to treat fibromyalgia, but there's still not one treatment that helps cure or help you cope with fibromyalgia. Ultimately, the most important treatment is exercise. It's highly recommended. There are many, many benefits to exercising with fibromyalgia. Some of those benefits include it can help your muscle, it makes your muscles healthier so they can handle physical and biochemical stress better. It increases the flexibility and length of your muscles. It increases oxygen flow to your muscles, improving muscle metabolism. It helps you sleep better. It can reduce stress and anxiety and depression. It can increase energy and endurance, and it can help reduce or control your weight. Another is balance. A lot of people with fibromyalgia have problems with balance, so incorporating that in your workout routine would help. So here's my case study. She's a 56-year-old female complaining of musculoskeletal pain and fatigue. She said the pain has come and gone for about 6 months, but recently the pain has been more persistent. She's having trouble sleeping at night, and her memory and balance seem to be affected. She's tried Motrin for the pain and over-the-counter sleep agents for her restless nights. The doctor has prescribed Lyrica and suggested exercise to help manage pain and improve balance. So her weight is, she's 136 pounds. She's 5'4". Her blood pressure is 122/80. Fasting plasma glucose is 96 milligrams per deciliter. Her LDL is 150 milligrams per deciliter. Her HDL is 40 milligrams per deciliter. Family history, she has no family history of cardiac or metabolic disease. In her lifestyle, she's sedentary, and she also smokes. So for my risk stratification, because she's over the age of 55, that puts her at risk. Her weight, her BMI is only 23, and that's normal, so that wouldn't be considered a risk factor. Her blood pressure would not be considered a risk factor. She's not hypertensive. Her fasting blood glucose is only 96 milligrams per deciliter, so that's good. Her LDL, even though it is 150, it is not considered a risk factor until it is 160 milligrams per deciliter. Her HDL is at least 40 milligrams per deciliter, so that's good. Her family history, she has no family history of cardiac or metabolic disease, so that's not a risk factor. But because she is sedentary, that puts her at risk, and she also smokes, and which is also a risk factor. So that will give her a total of 3 risk factors, which would put her at moderate risk, and she is asymptomatic. For exercise testing, I would do the Bruce treadmill protocol for cardio. Dynamic strength test, I would do a 1 rep max for resistance. Standard sit and reach test for flexibility, and Romberg test for balance. I chose these tests because they are all considered good tests for people who are sedentary. And it's important to find out the 1 rep max for her resistance training so we can figure out a percentage of how much she should lift. For her exercise prescription, aerobic exercise, she would do 3 days a week. It is recommended she does 40 to 60% of her max heart rate for 30 minutes a day. Some good examples would be water aerobics and biking. These are recommended for patients with fibromyalgia because a lot of times they'll have joint pain, so it's really good for joint pain. Balance and flexibility. Balance and flexibility is very, very important for patients with fibromyalgia as well. So I would recommend that 2 to 3 days a week for 30 minutes a day. And some good examples would be yoga and Pilates. Resistance training can be a little tricky. I'd recommend that about 2 days a week. I range that from 40 to 80% of her 1 rep max for 30 minutes each day, just because you don't know how she's going to be feeling that day. Pain symptoms can come and go, could be worse some days than others. So I would just really listen to your body and just be mindful of your pain levels that day. So anywhere from light to moderate weightlifting would be recommended. So my conclusion is that there's no known cause or cure, and it affects women more than men. It also affects children. Exercise is a very important role in managing fibromyalgia. Although there are many drugs out there that can help you cope with it, the number 1 recommended would be exercise to strengthen your muscles and reduce pain. And always consult with a physician before starting a new exercise program. And here are my sources, and thank you very much for watching.